and I'm going to call the Richland County Community and Health Services Standing Committee to order. Could we have roll call, please?
Miller. Here. Kramer.
Here.
Engel.
Here.
Welty.
Here.
Perry.
Here.
Collins Johnsrud.
Here.
Barris. Braithwaite.
Here.
Chicker.
Here.
You have to be for a quorum.
Do we have verification of open meetings law compliance?
It has been properly noticed on the county's website, the bulletin board at the courthouse, and also in the clerk's office.
Thank you. Number 4, need a motion to approve our 15-point agenda today.
I'll make that motion.
Okay, then I'll second.
Okay, thank you. Now, I think everybody has seen the march.
Sandy,
Yes, I'm sorry.
did you guys need to vote?
Oh, all in favor, please say aye.
Aye.
All opposed? Agenda is approved. Approval of the minutes from the March 5th, 2026 and April 2nd, 2026 meetings. Anybody have any additions, corrections, additions, or deletions? Okay. Hearing none, I declare those minutes approved as written. Number 6, we have public comment. Anybody online or here have anything that they want to bring in front of the committee today? Number 7, reports. Health and Human Services Director, administrative report.
Good morning,
Good morning.
everyone. Good morning. So in the packet are updates from all the different units and the different managers. I wanted to highlight from a director's perspective that public health staff, emergency management, and we attended a measles tabletop exercise at the hospital on April 21st. So we should all be prepared if that measles makes it to our county. Knock on wood, it doesn't. But it was a great exercise. It was an opportunity to collaborate and make sure we're all on the same page with the hospital when it comes to our preparedness in that respect. The ADRC just highlighted that they just had a volunteer appreciation breakfast. We have a lot of volunteers with our nutrition and transportation program, so we always like to appreciate them with that, doing that. Child and Youth Services, a highlight there is we have 0 children in out-of-home care placements currently. They're doing great work there. What happens is now they're starting to follow these, they're called Family First guidelines. And so the goal is to create safety plans, do all the things that they can do to keep the kids in their natural setting versus removing them. So a lot of work being done that way. So that's exciting. Behavioral health, big highlight in behavioral health is every year the Birth to 3 and Children's Long-Term Support Program has to have a review done of their cases. And in Birth to 3, if you'll notice that the focus areas, they scored 100%. So they fully met all the requirements of that program, which was exciting. A lot of work goes into making sure files are right and the kids are in the program, getting the services that they need appropriately. And then children's long-term support, we were highlighted as having a strong program, 96.3%. So that's also very exciting. And so all these kids are getting help they need, and that's pretty exciting. Economic support unit, the big highlight with economic support is next week is ESS Economic Support Specialist Week. So it's always exciting every year to recognize all the work that they do on the call center, all the processing that they do to help families be eligible for the different programs that just help supplement their income and whatnot. So that's pretty exciting. And then I think the last public health then is the last program on there. Highlights there we had a public health intern for the semester and her last day was last Friday, so we're gonna miss her. And she's the one that pulled together a bunch of data for the annual reports and was kind of keeping track of some things there for us, which was exciting. And then they're doing a lot of work with the chip updates, the mental health and substance misuse. They're meeting monthly on that. Evan is going around doing Make It Okay presentations for just for mental health awareness and just eliminating that stigma that's around mental health. So he's doing presentations there, busy with that. Any questions about things that we're doing?
I see that animal bites, you already have 9 cases for this year.
Yes, yes. Yes.
You don't know if they're mostly kids, do you?
I have no idea. We don't know. We don't know.
How is law enforcement handling that? Are they following up and making sure the dogs are?
They're, so is Brandy on? Brandy's not on, but when, yes, so there's different ordinances and things like that. So they work with public health, to kind of follow those, the guidelines with that. If law enforcement needs to get called in, they'll call them in, you know, especially when it comes to like if any tickets need to get written or things like that. Work with if the animal needs to get quarantined and go from there, so.
Good question. I see on this report that there's 49 birth packets that were sent. What's a birth packet?
It's for new parents. Just sends out information on different health topics when you have a new baby in the home. It's our maternal and child health packets that go out. Yeah.
So it's information?
Just information, resources. And we do have a nurse that will also reach out to do maybe a home visit if they think if a new mom or dad would like somebody to come in and just guide them through that, bringing that new baby home.
Thank you.
Any other questions?
Did you say there was no mental health placements?
No, we have mental health placements, children's, child and youth services placements.
Okay.
Yep.
Thank you.
No, mental health placements, we'll touch on base on that.
Yeah.
Later.
There's no further questions or comments. We'll move on to Health and Human Services expenditures report. Vouchers and expenditures over 2,000, but less than 10.
Sure. You'll see Kaylee Levy's not here today. She is at the Wisconsin Human Services Financial Managers Association conference. So she's at that learning all things health and human services related with regards to finances. So I'm covering for her today. For our expenditures, I kind of took a quick peek, not a lot to really point out that's kind of out of the ordinary. You might see tick tweezers. We ordered $1,800 worth of tick tweezers. We received a grant. Public Health received a grant, so you'll start seeing a lot of Lyme disease prevention marketing out there. And so that's something bought there. $1,300. We had a water heater blow, so we had to get a new water heater. So that's kind of out of the ordinary. But otherwise, as I reviewed things with the U.S. bank statement, you might have noticed that there's this Quality Inn that was over $5,000. That is that's that national conference in Nashville for the treatment court individuals that are going to that. So that money actually they applied for a grant on the opioid settlement funds. And the opioid settlement money is paying for that, but it has to go through, somebody's got to pay for it somewhere. So, but that's coming out of the opioid fund. It's not coming out of Health and Human Services budget. Mm-hmm. So that was kind of high. I thought you might catch that.
I did.
Yeah, so that's the hotels for that. Otherwise, nothing really jumped out. A couple of other trainings. There's $784 spent by Public Health. They have their refrigerators over there for the vaccines. and they have they're called data loggers, so they have to renew that every year so that we can make sure that our temperatures are staying good.
Hi, I'm new.
Yeah.
Just have a quick question. What are the Amazon purchases?
Sure. So Amazon, yes. So do you see where it says CLTS there next to that? A lot of our children in long-term support kiddos are eligible for certain accommodating items. So the Children in Long-Term Support Program purchases those through Amazon. So those are 100% reimbursed through Medicaid. So it's kind of just a pass-through. So
I have a comment about that. When I was also concerned about notice the high volume of Amazon purchases. It's about half of the expenditures that are listed there. And it requires additional oversight for the policies. You know, there's the procurement policy and then there's the credit card policy. And overall, there's really very little transparency around what was actually purchased.
okay.
It's a concern that I have, and is there an
We
opportunity
can
to
make that a
about
little
it
bit, we
in
can
a
make that
different
a
way?
little bit clearer.
Like maybe under a category of clothing or, I don't know, something
Okay.
to specify what it is.
Okay. And it might be, if we make it a little bit clearer with as far as like the program, and that would maybe help you understand how those purchases are also reimbursed that way too. So yeah, I can do that. Take that back.
Any other questions or comments before we move on?
Would that meet your two's question? Or what are you thinking?
Well, I understand the convenience of using Amazon. I just want to make sure that the policies are also being followed for those purchases, both the
Sure.
procurement as well as the credit card policies.
So how,
I was just gonna say, I also know HHS has additional policies
That's
when
what
the
I was just
credit
gonna
cards are being used that you could probably share with the committee
I
at a
can,
future time, so you can see kind of what that process is
that was
for
what I was.
approvals. And there's a form that has to be filled out when these approvals are made that goes through the different levels. So I think that might be beneficial to share that with the committee on how the oversight works. It's not just somebody can go grab the credit card and make a purchase. There's actual steps that are in place.
And there may be a way to, Amazon oftentimes has an upcharge because of the convenience part of it. Is there a way to perhaps lower the cost of those expenditures by going about those purchases in a different way? Maybe there isn't any other way to do that. Maybe the convenience is really important. I'm just concerned that half of the transactions here were through Amazon.
But yeah, no, Trish is correct. We have a purchase request policy. Before any purchase is made, it runs through a supervisor who signs off on it, and depending on the amount of the purchase, it comes through me. We have a business account with Amazon. I believe we have all of the discounts applied that we can have, but I can definitely have the finance manager revisit those, yeah.
Is it partially due to convenience? I mean, as far as being able to have it shipped directly to where that child is, or?
Partly,
Okay.
partly, and then that's the best place to find the items that they're looking for.
I think the other challenge, if you don't mind me speaking up, is we have it established with the tax exempt right on Amazon. So sometimes when we go to different policies, some of them don't want to do the tax exempt online, and we have to make sure we do that. So I do know that some workers are really good at like comparing prices, looking around. I mean, when I was over there, we talked about that a lot. Like,
Yeah.
here's this new vendor and it's cheaper there, so
And we'll do that.
use
We
it,
can find
we'll
it.
use it, and we will. But I can't say that all of them do that.
No. And the other thing too, because we're part of the Wisconsin Counties Association, we don't have a fee, like a subscription fee. And so that is also free to us because we're part of that and a government entity, so. But I can definitely make it a little bit clearer on what we're purchasing and maybe the program that it's falling under, for sure.
Anyone else? All right. Health and Human Services 2026 budget summary and the Richland County 2026 placement report.
Yeah. So this is me again. Like I said, Kaylee's not here today. It's still really early in the year. These are expenses and our anticipated received and anticipated revenue as of March 31st. And normally we kind of look at utilization. Where are we at for utilization? We should be at about 25% utilization 3 months in. First quarter. As I look through the expenses, you'll see the building and operation costs are a little bit high at 30.9%. But this time of year, they always zap our account for the workman's comp, which is just a big chunk that gets charged to our account the first part of the year. So as the year goes on, that'll kind of level off. And then the only other thing I just wanted to note, CCS, our Comprehensive Community Services Program, it's at 16.9%, which seems low, but that program where we've only expended 2 months worth, that's always a little bit behind based on getting provider invoices and things like that. But it's still within the normal range at 16.9%, even though that it's only 2 months worth. So if we look at the final budget balance after we incorporate our revenues, it's showing a negative balance, but $10,000 this time of year is nothing to be concerned about. There's anticipated revenue that we haven't even considered yet, like WIMCR later in the year, Wisconsin, Medicaid reimbursement here and there. So there's still a lot of moving parts that just won't settle down for a while. It's early, so yeah.
I have a question about the under chargeback where it says chargeback for MH Institute through March that have not occurred.
So when we have somebody in Winnebago or Mendota, the state of Wisconsin, we submit reimbursement, expenditure reports for reimbursement from the state of Wisconsin for some of our contracts. If we have somebody in Winnebago or Mendota, they hold back what we owe them out of our revenue, right? So we only get a portion of that. So we might submit a claim for $100,000, but only get $6,000 back because we have somebody in Winnebago, right? So this is just letting you know that our revenue's reduced because that anticipated revenue is been reduced. And so then the chargeback down at the bottom is basically, it's a journal entry correction that has to happen across, I say across the street, but I am across the street. That has to happen through the clerk's office to take that from our placement fund, which is Fund 540, take it from the placement fund and put it in our general fund, our general fund. So that's what that chargeback is. That's just basically saying that it hasn't been moved yet. The money hasn't been moved yet. The journal entry correction hasn't happened.
Okay, thank you.
Yeah, you're welcome. No, I know you guys are. I'm like, these are new names. I knew there'd be questions.
Any other questions, comments? Anyone online? Thank you.
And so also with this section of our report is the adult placement or the placement funds. So we have 2 placement funds, one for adults, one for children. And like I said, children's earlier, I said we don't have anybody right now. So that's actually at like 2% utilization. So that's looking good. But knock on wood, everything goes okay with kids being able to stay at home. But the adult placements, it's running a little high right now. We do have one high cost placement right now. We're working diligently to transition that person to a lesser restrictive setting. But this is what happens when you have somebody that has some severe mental health.
So for the folks that are new, do I have this right? This is like the wild card.
This is a
You
wild
never
card.
know.
Just
So
never
some years it's like $1.5 million
could be potentially.
or lower. but yeah,
And
it fluctuates.
And it's in response to need, right?
Right.
correct, yes, and depending on the level of services that are needed, you could, so Winnebago just is $2,166 a day. So add do 2166 times 365 days. That's where the 1.5
Yeah,
million
these are like
comes in.
mandatory.
Correct. So
So we have no choice.
right. So they work really hard to try and find at least lesser restrictive placements. Sometimes you can, sometimes you can't. Sometimes you can find a lesser restrictive, but it's still going to cost you that much potentially, depending.
And does it depend on, is it also possible some of the placements could be short-term or long-term?
Correct.
Do you know the percentage of adults that are placed out of the jail to mental health facility that the county ends up paying for?
That I do not know. None this year so far that I'm aware of.
This is the one they look at with bated breath every year.
So, but just know that, we're always trying to find the most, the least restrictive setting for these individuals, based on their needs, and find the most cost-effective, but finding the most cost-effective one as well. Some of these individuals, if they're eligible for the Comprehensive Community Services Program, we will work with the facility or the adult family home or CBRF to have them become credentialed to provide these CCS services, because then Medicaid can help offset some of those costs. But sometimes some providers are cautious about doing that as well. We work with them for that too, to help offset that. That can't happen with Winnebago. That we don't have a choice with that. But yeah. Yes, you're right. The wild card. Any questions?
About a year ago or so, I asked this question, and we had no homes in Richland County. Have we any now?
Homes as in adult family homes,
Yeah.
or?
Well, over by Viola, there's a group home of some kind. What is the classification of that? Because there are people there, unless they live there. I don't know, if they own it now. You know where it is,
So those are either an adult family home, sometimes they're like a community-based residential facility. There's like different classifications of those.
we still use those people.
Correct.
Those in this county.
We don't license them, they're licensed through the state or other entities, but we do contract and use them.
How many do we have? Approximate,
We just looked that up the other day, like Richland that are like surrounding, and there's actually like a listing.
Yeah, DHS has a listing that goes out that you can Google adult family homes by county or throughout the state that list community-based or residential-based facilities.
Yeah.
one of those people, are they always full?
Occasionally we'll get an email saying, hey, we have an opening, but they're usually pretty full. But not necessarily even by Richland County residents, correct? Because they can, counties throughout the state are doing kind of like we do, call around to anybody and everybody where they might have an opening, so, yeah.
What is the cost of that for the county?
The county,
Any idea?
for the county?
Well, the cost would be
Or well,
placements
not for
like
the
this.
county, I mean, for what we're looking at here, really.
So, right, so if you look at the adult community residential placement count row there, that shows you that we currently have 6 individuals in adult family homes or a residential placement. It could be a CPRF. And those cost about, the one is 13,000, 7,000, 11,000 a month.
A month per person?
No, total.
For the what?
Total, that's total for the month for all 6
Oh,
individuals.
okay.
I mean, I think rates can go as as simple as $100 a day, all the way up to $1,000 a
It
day.
just depends on the cost of the home, right?
The needs of the consumer.
How many staff, how many, you know, what are the expenses of the home?
And that is all Medicaid or Medicare, or we have to pay.
A lot of that is paid through for us. So
We-
sorry.
No.
When people are in CCS placements, so if they're in the Comprehensive Community Services Program, some of the costs can be billed to that program, which is billed through Medicaid, and that's just based on consumer need. So if they have a need to learn how to manage their meds, we can set up a care plan that talks about what steps can be taken by the home to help this person be able to manage their meds on their own. Ultimate goal of that program is to get people as independent as possible. And so we would set up goals on how do you manage your, how can you manage your daily living skills? How can you manage your meds so that they can hopefully someday go and live on their own.
Thank you.
I do have a question. Do any of these adult family homes, are they billed for any of these costs for placements? Or is it the
The adult family home
responsibility?
or the resident?
Or the resident?
We do, there is a room and board portion that the resident would pay. So they're paying towards it.
Anything else? Okay.
I mean,
Wine Valley Community.
no, it's not.
Good morning. For those of you that don't know me, I'm Brittany. I'm the administrator over at Pine Valley, which is the skilled nursing facility. So we are licensed for about 80 beds, and we have a assisted living that is 16 beds. We are full on the assisted living and have a waiting list at this point. And then right now we're about 65 for our skilled side, with a couple admissions and the rest of the stage coming up. Surveys, Jesse and I, we went to DHS meeting at the state capitol last week or something like that. Just kind of learned more of their upcoming changes. So a lot of things are going electronic. So like our plan of corrections, our statements of deficiencies all go on a portal essentially. And then they're changing how we submit documentation to them. So they changed it to, and they're going to be changing it to Docs, which is where we submit all of our paperwork to them. They went over the next step kin law, the new one that just passed about how representatives, without actually having an activated POA or having any of that, they're can admit them into a skilled nursing facility without actually having them activated or having those necessary papers in place. So we got that. Based off that meeting, just kind of the most recent citations that they've been seeing. So they kind of gave us that. So we are focusing just our eyes and ears onto those things. We are meeting monthly with the staff. So our May monthly all staff meetings, kind of going over previous survey history, because that's something that they look at. As well as kind of like the things that the state is seeing and just getting them prepared for survey. The ins and outs, and you know, we have some new staff, brand new CNAs, so we want to make sure they're prepared, you know, because it is a very challenging time when we have our annual. QAPI, we implemented angel rounds, and this has actually been going really well. It's just kind of aided in kind of reducing the amount of complaints or grievances that we have. Working right now on our care plans. Just making sure they're getting person-centered care and just approaches in their care plans that are specific to that person versus a generic. So we're working on that. Staffing, we're actually for CNAs are getting pretty good. It's our nursing staff that we struggle with getting that full. Retention, me and Angie, or me or Jesse, we end up going to job fairs that are specific to high schoolers because they get their CNAs. We went to Southwest Tech's our biannual, job fair as well. So we did get, she's going to be an LPN in May, so she's coming, on with us. So, and then obviously we're celebrating National Nurses Week this week. We have things going on with them. I think we actually have a potato bar today for them, as well as just kind of, going around and saying we appreciate them and spending time acknowledging all the work that they do. And then we have National Nursing Home Week that is coming up for our residents. So we're going to be celebrating that with the staff and the residents as well. Facility maintenance, obviously we are doing our preventatives. We are working with Mike Siz at Sheriff's Department about our community-based requirement, which we're supposed to do annually. So we are doing something with active shooter, and going to be planning out that actual drill, with the facility. We did have them out last month in April to kind of we rewrote the policy on that with the Sheriff's Department. And that went over, lots of questions were asked, which is great. So now we're just gonna move towards that drill piece. Preventative maintenance, after this, you'll see that we have another section here about our roof. So we'll kind of go over that around that time. Dining and nutrition, we have a new dietary manager. She kind of transitioned into it and it's been fantastic. She's been doing great. Residents are more satisfied. She meets with our problematic residents who are very hard to satisfy in all departments. She meets with them weekly. So this last week, she's had absolutely no complaints. They had a menu planning meeting, I think it was Tuesday, and no complaints again. Very happy with how things are going there. We have touch base with Matrix, which is our EMR system, which we chart on our residents. We just have some issues that are going on, with just being able to go paperless. So we got a ticket out with them. Hopefully we either upgrade the system or fix whatever issues that we're having. And resident council has been going pretty good. We just kind of highlight their rights, questions and concerns. We had a vaccine clinic. So yeah, I think overall things are starting to smooth out and get a lot better. So excited for the future.
Any questions?
I was gonna ask you, a year ago, you told us that we were gonna have to redo the lighting down there at the, there was something wrong, or it was outdated, couldn't get them fixed.
Yeah, the lights, and we're slowly replacing those.
You're just going on your own.
Yeah, Chad's been able to kind of locate some things to try to replace some things here and there, but yes, we were luckily enough able to find some light bulbs for them, which have kind of gone extinct. But I think, yeah, we've been able to correct them for the most part.
So we're gonna have that in the future, like.
Potentially, yes.
Sort of. The other thing was the roof. What's wrong with the roof?
We have a lot of structural issues with the roof. Just the other rainstorm and windstorm that we had shingles flying everywhere. So we have several rolls of those going, and Chad and our maintenance people have been going up and putting them back on. But with the structural issues, we have a lot of heating issues where all of our heat pumps sit. So
what?
Where our heat pumps sit, so where everything that heats our building, all those 256 heat pumps that we have in our attic area, kind of get overheated due to the ventilation and how our roof is sitting.
How much, have you got any bids on that, or are you just looking?
Yeah, that's gonna be coming up on, we're number 12 to go over the.
Oh.
Yeah.
Oh,
Yeah.
I'm so excited.
I know.
What we're thinking.
I have a question. You explained that you had implemented angel rounds. Could you explain what that is?
Yeah, so all of our management team have a set of residents. So we have a set of rooms that we're supposed to visit weekly, more if needed. So like if we have a resident that has a lot of issues or, just needs a little bit more support, our staff go in there and we just kind of touch base. We check their room, we check their oxygen, making sure things are labeled, making sure they're happy, making sure they're not in pain, making sure that we're just kind of looking at them as a whole and their environment as well.
And who's doing that?
All of us management. So everyone that, so like our Chad has a set of rooms. All of our nurse managers have a room, our DON have rooms. So it's all kind of split up so we cover everybody in that building.
Thank you.
I do have one more question. Travel nurses. Still there?
Mhm.
More or less?
It's about the same. I mean, we've had a lot of leaves, not like quitting of jobs, but just kind of like medical leaves of absences. So we've had a little bit of influx of needing, but our college students are coming out. So we should be able to see a little bit less here in the summer if they're not doing like an all-around schooling. And then obviously when they go back to school, we might see an influx again, but.
Are they RNs or mostly nursing assistants?
What are you,
The travel people.
It's mainly RNs. So with the change of condition and scope of practice, we have decided to, for like our long-term contract, we allowed LPNs so that they are here for a period of time, but like, let's say we need a shift filled and clipboard comes in, it's only allowed to be an RN because of the rules that we have that LPNs can't do a certain set of practices, and we'd rather just be able to have that RN to do their own thing versus going outside of their scope of practice.
Okay.
Any other questions for Brittany? Thanks, Britt. Okay, Child Support Director's quarterly report and budget report.
Hello, everybody. So for the new members, I'm Melanie Milford. I'm the director of the Child Support Agency. Before I launch into this, just to give you guys a little background, the Child Support Agency Child Support Program is actually a federally mandated program. The federal government mandates each state has a program, and then the states sign contracts with the counties and tribal agencies to administer the program. Most of our referrals come from economic support, which would be pregnant women or children that are signed up for Badger Care benefits. We also have divorce cases that we become a party to their case, as well as participants can come in and apply for our services. But the majority of our referrals do come from economic support. We establish paternity, we set up financial and medical support orders, and then we enforce those orders up to finding people in contempt and sentencing them to jail and issuing warrants. Right now we fluctuate between like 750 and 775 for cases. We're currently a 2-person office. So I manage half the caseload, and then Charlene, our other caseworker, manages the other half. So we're busy. So on the top part of the report is our performance measures. These are measures that the Bureau of Child Support has established for agencies, and then the benchmarks that we try to hit. So for paternity establishment for the first quarter, we exceeded the benchmark of 90%, which means that the percentage you see, any open paternity case, so in March, 99.32% of our paternity cases, we put a father's name on the birth certificate. Court order establishment, we exceeded benchmarks for all 3 months of the first quarter. That is same thing, any open order case that we have taken it to court and got an established court order, whether it's financial, medical support, or both. Collection of child support. That one's in yellow because we have not hit our benchmark. This has been a statewide struggle. For quarter one, only 25% of counties and tribal agencies were able to meet that benchmark. The last year has been a struggle. We've been trying to do additional outreach, reaching out to other counties. Every other month I'm in director meetings that we're everybody's trying to figure out, how do we get people to come in every month and pay their full child support?
Hmm.
If they are employed, we do send paperwork to their employer and get their wages garnished. So, but we do have, we're seeing an increase of people that are incarcerated. They are homelessness, they're unemployed. And we try to offer as many resources as we can, but sometimes that's all we can do is just offer them. They have to want to help themselves. And then the last benchmark is our arrears collection. Arrears is past due child support. This performance measure resets at a 0 on October 1st. We follow the federal fiscal year. So October 1st, that benchmark resets to 0, and we have the entire year to get it to 80% or greater. At the end of March, we were at just shy of 75%. So if we keep chugging along like we are, that hopefully next time I come in for a report should be in the green. So, as far as staffing, we have an open part-time clerical assistant position. I did do interviews about a week and a half ago. I made an offer and I just received her background check completion today. So I'll be able to contact her today to set up a start date for her to start. That is a 15 to 20 hour a week job. It is not benefit eligible. Basically just to help with some of the administrative functions in our office that Charlene and I can't get to because of our case management, filing, scanning, mail, things like that. And then I will be attending an in-person leadership meeting in Rock County in June. This is all the child support directors for the southern part of the state. We meet once a year and we have a day-long meeting where we just have, it's brainstorming sessions, getting ideas from each other. It is extremely beneficial, so I'm looking forward to going to that. Our budget reports are as of March 31st. We are sitting good for our expenditures. We have 78.17% of our expenditure budget remaining. The one area of concern that I wanted to point out to you guys is we have a line item called paper service.
Mm-hmm.
This is this is the fees we incur to have participants served for court hearings. There are certain court hearings, we can just mail it to them, but there are certain court hearings such as contempts that we have to have the parties served. Their options are they either come into our office and pick them up, which if we're finding them in contempt, they usually don't want to come into our office. So we turn them over to a county sheriff's department. They go out and serve them. We have to pay the bill. And then we, at the court hearing, ask to have it reimbursed to us. The issue is counties that we work with have been increasing this year their civil process fees. I just received an invoice last month from a county to serve a gentleman and all the mileage accrued to drive to his home. The invoice was just shy of $200. So, and historically we budget about $2,500 for the whole year. So I expect that one to go into the red quite rapidly. So that's one that I'll be monitoring and making sure that for 2027, our budget is adjusted accordingly. So 66% of our expenditures are reimbursed by state and federal funds. So every month I submit a claim of what we've spent on wages, benefits, and anything on the expenditure side of this, office supplies, computer equipment. And then at the end of each quarter, we receive a reimbursement for 66% of that. So while it is not on this budget sheet, because this is for the end of March, we did receive our Q1 reimbursement on the 30th of April for $58,708.60, which is actually more than I was estimating, because obviously for the first quarter you want, like 25% back, and that's 36%. So as of right now, our revenues are a little bit ahead of what we were expecting. We just completed our annual review by the Bureau of Child Support. Every year, they set up an annual review with our agency. It's just conducted by Zoom. They send me a worksheet I have to fill out, and then we go over the worksheet in the review. This review is just to make sure that we're in compliance with that intergovernmental contract that the state of Wisconsin has with Richland County. When I wrote up my report, we hadn't received it. I actually just got the finalized review this morning, and we are 100% compliant with our contract. And then the Bureau, during that review, said that they are continuing to focus on policy guidance regarding how agencies deal with victims of domestic violence. So at this time, we're not required to have a written policy, but I did go over what our process is in our agency when we do have participants on our caseload that are victims of domestic violence. And she said, that all sounds wonderful. You're doing exactly what you should do. And if they decide that agencies should have a written policy, they'll send us that and I'll write it up, submit it back to the state, and if they approve it, then it becomes part of our policy and procedure manual for our agency. The last thing, which is not on my report, I just wanted to point out is this week is actually Public Service Recognition Week. The governor issued a proclamation recognizing all public servants and employees of public service entities, which it would include everybody sitting in this room right now. So I didn't know if you guys were aware of that, so I just thought I would let you know. So, and if anybody has any questions.
I do.
Yes.
How closely do you work with probation and parole and collections?
So we contact probation and parole to obtain information about our participants. But we can't, like, we can tell them, hey, you know, they're looking at possibly getting contempt action or something, but it's more just collecting information about the person. Where are they at? What's their sentencing gonna look like if they're facing incarceration? You know, more like locating them. We haven't been able to get in contact with them. Do you have an updated phone number or address? So we do utilize probation and parole when we can.
Because I know they can put it on their rules that they have to pay their child support. Failure to do so would be a violation of their supervision.
Did not know that.
I was wondering if that was an opportunity to serve them too and reduce your
Exactly.
service.
You know, I don't think we've ever used probation to try to serve someone. Like
I
I
don't know if
said,
you can do that, but you
Right.
can at least work with the agent.
right. And a lot of times, yeah, it's, again, if we're to the point where we're gonna file contempt action against them, we have tried getting a hold of that participant in every way, shape, or form that we can. And then that's usually logged in our contempt action is, you know, we've tried mailing them, emailing them, texting them, calling them, and absolutely no response, so.
Because they may have moved out of the county and the probation may have transferred the case,
Okay,
but they would still be able to have access to know where that person is.
thank you.
Any further questions?
I've got one, I don't know where to ask it. I had a neighbor ask me the other day in our little community out there, we've got old homes. Some of them are not really very nice, but somebody will buy them for $60,000 or $70,000. And immediately there will be a family in it. Is there any oversight in that at all when it's sold by? They just goes from one person to the other. It's sold as is. And is there any oversight in Richland County that goes in to see if it really is safe or if it's, well,
That might be like a zoning question. I don't know the answer to
a
that.
zoning question?
Yeah. I can find out. So like houses are sold as is and
As is, and they go from one owner to the next.
yeah.
And they never do anything but throw out the garbage and stuff from one, it seems like, and maybe paint the door and back in. And they're charging like $800 or $900 a month for those. But, and I know housing is short, but it seems like it's kind of questionable living to me.
Your question is about whether it's safe.
If it's safe or
Yeah.
what, or, you know, there's been a hole in the basement for years. And it's an old home, and we just wondered how they even, and they got kids in there too, so that it's a children, but I think it's adults, if they wanna live that way, fine. But, I'm not going into any of that, I'm not gonna pursue it because the police have been there, and if they think it's absolutely not workable, they should be taking care of it, not us.
Right, and if they feel it's unsafe for the children to be in, they should be making a call to Health and Human Services and making a neglect report.
Or if there's maybe an environmental, reason why it can't be lived in, right? And to, I said, you know, then public health might get involved at some point, but.
No, I don't wanna.
But as a practice, yeah, I don't.
Well, I just wondered if there was a law or something against, why don't they have them checked from who, I mean, why can't, if you're gonna sell a house and you're just wanting to make money on it, you don't really care who lives there, and you're not doing any upkeeps, we're all feel bad about that, you know, that, because the kids are the ones that are the ones that always suffer in those cases.
There are inspections as far as septic systems and things like that that happen periodically. There's a log that's kept in, when people don't comply with the inspections, the enforcement of that is challenging.
That is even, what the place they're complaining is, that they can't have a real septic system, they've got supposed to be cleaned every month. I have never, in my 4 years, ever seen that happen.
Sounds like a public health issue. I would think that'd be a public health issue, it should get reported to Health and Human Services.
Well, ours is checked every 3, I think it's every 3 years.
Septic is different, septic is zoning.
Septic is on.
So,
I guess have a pump every.
yeah,
Inspected.
Yeah, they do that.
well, they do they do it for, what do they call it, when you just have your sewage and they come and take it out of the concrete,
Pumped.
you know, it's, yeah, it collects, and then they're supposed to have it cleaned or it needs to be, if you got a family in there, every 2 months anyway. And I don't know how we can even sell them that way, really. But just telling you, it's out there. And little old ladies notice it, everything. And I'm not talking about myself.
Madam Chair, just very quickly, I just, again, because there's some new committee members. So I only report quarterly to this committee. So in the meantime, if you guys have any questions, you can email me, you could call me, or just pop down to the office and, you know, we can have a conversation about it. Because again, I won't be back until probably like August. So,
Well, it sounds like you have plenty to do in the meantime.
yes.
Thank you.
Thank you.
All right.
Thank you.
Any other questions? Moving on to number 8, discussion and possible action, changing committee meeting time. I know, Brittany, you have a problem with getting here by 9:30. If you have some sort of,
Here early enough, but I usually cut like my morning meeting short, just especially with the construction. But I prefer to be able to do it after morning meeting, because that's kind of where we discuss any resident things, upcoming things that need to be worked on.
so how long you think your meeting would be?
I mean, usually we don't get out until like at least 9:20, and then I'd have to drive over. So even like 10 o'clock.
10:30 would be, okay. Anybody else?
This morning is blocked off for Health and Human Services Committee, so.
Same, I usually just block off the morning.
Any comments from,
What was Mrs. Chicker's issue with time?
I'm not sure, Cindy's here.
You
online.
need to change a PIN number.
Yes, I'm online.
Update anything on.
Is there a problem, Cindy, changing the time to a later time in the
You
morning?
have a whole bunch of new games in.
Only
We are putting
because
some new
I've
ones
now
so
got
there is
the
a little bit of
9:30 time
construction going on.
memorized.
Madam Chair, I'm trying to figure out what we're picking up.
Probably in her background, maybe.
So in the meantime, I'll make a motion for 10:30.
Is that, Cindy, is that gonna work for you?
No, okay, one of the
It
questions
should.
I
I
normally
just
get
have
asked
to
is
make
where's
sure
the
it's on all my
nearest
calendars, that's
restroom?
all.
And
She said it should. Yeah, she must.
Yeah, we're getting a lot of background noises, Cindy, and we're having a hard time hearing you.
That's
I
because
just
I'm
want
on
to
a
let you know
bus.
as well that the bus will be departing from this spot at 3 o'clock and you'll be leaving at.
Cindy, could you put your answer in the chat?
Sure.
Okay, so in the meantime,
She said,
all right, good. So we have a motion on the floor for 10:30. Do I have a
Second,
second?
before you go, does that work for you, Francis? Can you still?
Yeah, 10:30 is fine, thank you.
Yeah, it is, okay.
Need a second?
I can do a second.
Second, Mary? Any other discussion? Hearing none, 10:30 will be the new time for our meetings. All in favor, please say aye.
Aye.
All
Aye.
opposed? Okay, 10:30 it is. Thank you. Helps me out a lot too. Number 9, discussion and possible action. Approve amendment to Dungarvan, Wisconsin LLC contract. What is that?
So tying back to the placement report, how we always try and find a more suitable placement, a less restrictive placement for individuals. This is an opportunity for us to take the higher cost placement and move it here. Not a loop, still up there in price. However, this is a place where they're potentially going to be CCS certified, so we can get reimbursed through CCS. This particular contract, we did get it started to secure the bed, and then we need to move to increase the contract to get us through to the end of the year for this individual. And we're estimating for the rest of the year, it's gonna cost about $425,000. So because of the procurement policy that you referenced earlier, because it's over $250,000, this has to go to full county board for approval. So that's what I'm asking for today to move this on.
I have a question, but do we need a motion for, discussion? I'll move to approve the amendment.
We have a second?
I'll second it.
Okay. Now we can.
So.
Question?
My question is, so while this contract would increase in payments to this particular vendor, would we expect to have an offset and a decrease to another vendor? So that if, that's how I understood this, that this contract would be to serve the same person, but at a lower cost provider than what we're currently using.
Correct, this is lower cost, right? This is particular individuals currently in Winnebago. So this is lower cost, and not even just lower cost, but lesser restrictive, which is really the ultimate goal. Lesser restrictive, the cost, if we can get something at a lower cost, then that's what we attempt to do. And if this individual ends up here and ends up settled and everything goes well, and we can get the CCS services started, then it reduces the cost to the county even more.
Curious as to what that savings would be?
Hmm?
Curious as to what that savings would be.
For this particular home, you mean compared to Winnebago, not a lot.
Okay.
Unless we can get the CCS up and running, and then that would
So it's a less restrictive.
less restrictive, right? That's the ultimate goal, less restrictive.
And would we place this person here without that certification? I don't really
Correct.
understand what the certification is.
Without the CCS
Yes.
credentialing, right? So, as Trish explained during this program, if these individuals that work in this home become credentialed as CCS providers, then they can provide med management, provide independent living skill services and those kinds of things. And those services can be charged back to Medicaid. So that's what we do try to do with some of these homes. If a home refuses to do that, we would probably keep looking for a home that would do that. But at the end of the day, it's also finding a home that has a bed that has all of the things that meet the needs of the client. So this is a facility that has a bed and is willing to work with this individual with these particular needs in a lesser restrictive setting.
Would that particular individual's case then be transferred to Madison? Or would it stay with the county?
It stays with the county where whatever the county is that has that protective placement in place is the county of responsibility. So.
And that is usually a court-ordered placement?
So by this vote, we would be recommending this to the full county board?
Yes.
The resolution, is that correct?
Correct. Because of the amount of the contract.
Right. Any other questions or comments?
I have a question. How long will this individual be at this placement?
Could be forever.
Yeah. To serve one person, correct?
Yes.
It's expensive at that level
Yes.
of care.
That's why it's welcome.
Correct. I just was on a meeting the other day, a director in another county, they had somebody in a placement, I'm not sure it was this high cost, but 28 years.
Oh, wow.
I have another question. Is this person, I can't answer this. Is this a county resident or is this someone that moved here due to a placement?
This would have been a county resident at one point in time. I mean, yes. And there are residency rules that we have to follow as well. So if there is somebody that does come to Richland County, right, and they're just passing through, we do refer back to the residency rules.
Is that a year or how long is that?
Hmm?
How long is that typically that they're a resident of the county
Oh,
or traveling through?
oh.
They established residency and that, like,
Yep, there.
Yeah.
get an apartment today and tomorrow there's something that happens.
They're ours.
Even with homeless individuals, sometimes those end up
Here as well.
being our resident.
And we look at things like the intent to reside and all those kinds of things. There's actually bullet points.
This is one of those mandated services
Correct.
that the state doesn't provide resources for,
Correct.
right?
Correct.
Is there any reimbursement from the state or zero? Zero.
That's why we strongly, we work really hard to find placements that are willing to become credentialed like the CCS program.
So at least then that way you could bill Medicaid.
The only other thing that's in the works right now with Medicaid is right now Medicaid does not reimburse for IMDs, institutions of mental disease. So like Winnebago is an IMD. So currently Medicaid does not pay for any of that. But there is, they're working through the process, the state is with CMS Medicaid to get a waiver set up so that Medicaid will start reimbursing some of those IMD costs. So then that, well, wouldn't be 100% reimbursement, at least that $2,166 a day for Winnebago wouldn't cost the counties as much, but that's still working through the process, long time down the road. Last I heard, at least a year before that's even something that's gonna happen.
So with the Medicaid reimbursement amount, it most likely probably doesn't match what this entity would charge. What happens to that difference then? Is it written off? Is it become the town's responsibility?
So this CCS program is kind of an interesting program. We can, we get reimbursed an interim rate, and then every year we have to do what's called Wisconsin Medicaid reimbursement or reconciliation reporting. So then what we do is we report back out all of our true costs for this program, and then we get reimbursed the difference. So anything that CCS is 100% reimbursed, except for room and board. The room and board portion, then that would get charged to the individual.
I have a question. If this placement is not yet CCS, aren't we kind of jumping the gun? You said they're going to be. Are we just anticipating that?
So this ties back into the least restrictive, right? This individual is not at the level of care that they need Winnebago anymore. So we can't keep them there legally, right? So we have to find a place for them to go and live. And this facility actually said, sure, bring them here. Not for the lack of hundreds of phone calls. Yeah. I know, it's hard. You're like, whoa, it's hard.
So this kind of parallels the state's mandate to townships to have ambulance service without providing tools to fund it.
And funding.
And I will say, we do get funding from the state, so the state does give us funding, but it's not necessarily funding for placements or mandates. They say, here's a little pocket of money that we're going to give you, use it to cover this plethora of services, similar to townships. Here's this little pocket of money we're gonna give you, but here's the plethora of services that you have to.
So
that's where county levy covers.
Correct. So that's where I could say that I could take 100% of our base county allocation, right, and use it to pay for a placement, but that's only $500,000, right? So either way, tax levy is gonna come in at some point, right? And then if I take that $500,000 and apply it to a placement, then that leaves nothing for the operations, for the staff to make all the phone calls. Yeah, it's not enough. Yes, we do get a little, it's not enough. So that's why we have the ask for the tax levy for our placements.
Yeah,
Great questions, though.
So we should talk about unfunded mandates with our legislators.
And I would say that we have some very good staff who are very good about doing that when they have the opportunity. They share that information, but yes, absolutely at the board level, please be doing that. Please be sharing that. And I think that's part of what Brittany talked about with her legislative day last week. Many legislative days happen. I know Roxanne usually goes down for that to talk about here's our challenges. Here's the things that we need to do, and here's the challenges that we have.
Any further discussion and questions, comments? If not, all in favor of sending this on the county board, say aye. All opposed, say nay. Hey, this will move on to county board. You're coming to that meeting?
Oh, sure.
Yeah.
Oh, wait, when is county board?
It's
Tuesday night?
I can do it. Oh, this next, that happens. I will be there. Yes.
So
Yeah.
it goes to the exec and finance, right? Not to the county board.
goes to county board because it's already been through us.
Trisha's got my back. I'm on vacation that day.
On the 19th.
My only question is, we're still in discussion, are we? Is it closed? Oh, okay.
Yeah.
There was a vote.
Okay.
All right. Number 9, discussion and possible action to approve the amendment. Sorry. All right, discussion and possible action. Approve changes to CCS, CST, CCOP Coordinating Committee.
So first of all, you're probably like, that's enough acronyms, right?
Yeah, I was going to ask you.
Sure. So
Spell them.
CCS, Comprehensive Community Services, has to, is required to have a coordinating committee. DHS, the statute that program falls under, it has a committee for that. The coordinated services team, or coordinated services program was required to have a committee. And then CCOP Child Community Options program funding for that has to have an advisory committee. So in the past, CCS was its own, and then CST and CCOP had its own, so it was 2 separate committees. But we are no longer doing the coordinated services, the CST program. That grant is a grant that went back to the state. We don't have that grant anymore, and so we don't do that program, so there's no need for that committee. And CCOP was under that committee. So what this request is to basically disband CST CCOP and then put CCOP in with the CCS committee. There's no county board members on this, so it won't go to county board, but it still has to go to committee on committees, so we can make sure the member list is accurate. So that's why I'm bringing it through here.
Motion to approve.
We have a second. Now we can discuss. Questions? Comments?
I have a question. Why was the grant ended?
Why was the grant ended? There's a match to that program. And when we created the 2026 budget, we were looking at different, when you talk about mandated versus non-mandated type programs, this was one that we let go because of the match to save tax levy for the 2026 budget. It's basically it's a wraparound program that was kind of wraparounding, doing some wraparound with kids that are in CCS and some other things. There wasn't a lot of activity in the program. It was really, I think, over the last couple of years, we only ever had like maybe 1 child in it. So it was just one of those that, so we haven't seen a negative impact by letting that grant go. So yeah.
Any other questions or comments? Okay, hearing none. All in favor of sending this on to Committee on Committees? Please say aye. All those opposed, please say nay. Okay, so move on to Committee on Committees. Number 11 is recognition of an employee retirement.
And this is also me. So we had a retirement, May 1st, Barb Addison, who has worked for the county for 18 years as a county employee. Previous to that, she actually worked as a subcontracted person with Family Care way back when. So even though she wasn't a county employee, she's worked for Richland County for a lot of years. And last Friday was her retirement, and we wish her all the well. And we would like to recognize her with a resolution for those 18 years of service.
Motion to send this on to the county board, full county board.
Second.
Resolution number 26-XX.
Second that.
Okay. Any discussion, comments? Hearing none, all in favor, please say aye.
Aye.
All opposed, please say nay. All right. All right, Brittany, you ready? Discussion and possible action. Review and approve bid for roof at Pine Valley Community Building.
Okay, so back to that discussion. So obviously we have some structural issues and gathered about 4 or 5 bids for everybody to review. A lot less than we anticipated it was going to be. so that's helpful. But I'm gonna let Chad kind of just talk about like the structural issues and just kind of what we're seeing and why it is apparent that we do handle this situation sooner rather than later.
Well, you don't know, I'm Chad, maintenance supervisor at Pine Valley. The roof was put on 10, 11 years ago when the building, built. Wasn't quite properly vented, so we've had some issues with, moisture, we've had some issues with other things. But our shingles, every week we're putting some back on that have either blown off or, just disappeared. We have 3 spots that have been leaking. I put a bunch of roof patch on. Seems to be working for right now. I don't know how long. I mean, it's just depends on how long, or if the wind or the weather or something takes off that part. So when they remove the old shingles, we're gonna put in some more venting, better ridge cap, stuff like that, vented ridge cap, so we have proper vented roof. And then hopefully that's gonna help us with some of our other issues in the building.
I mean, they are heat pumps and things like that, so, hopefully it'll alleviate, like, a heat pump to replace it is $25,000. We have 250 of them in our roof, or in our ceiling area, so the idea is hopefully we can get it properly vented, that we will have a lot less issues with our heat pumps and having to replace those.
I'll take some stress off that. We have a bunch of heat detectors in the attic that, excuse me, when it gets 95 plus out, they're going off and they're set at 160 degrees. And it's at over 160 degrees in there, and I can contest to that because I've had to replace them in there. And so when I'm replacing them with ones that are self-reset. The ones that are in there are not. They were throwaways. So it was a one-time use deal. It gets very hot in there. So hoping with redoing the roof and getting the proper venting in, it's going to help us with some other issues that seem to occur.
With the wind and the shingles, are you thinking metal or are you thinking shingles?
Shingles. Well, every roofer, the bids that I've talked to, I talked to them all. And when they come out to look at it, and steel would be at least twice, if not a little more than twice of the shingle price. I have to walk out there on the roof twice a month. I check all the kitchen exhaust hoods, all the belts, all the fans. And this weather, we have 5 months out of the year where it's questionable to be walking. I really don't want to walk on a steel roof on that. You know what I mean? Plus the shingles are half the price.
So our recommendation after kind of the bids and stuff, is Heiser exterior. I know it's a little bit on the higher end, but they're also installing our solar fans for free. They're doing a lot more work. Plus, he has what's called Roof Max. So, that's something that we kind of discussed last year with him, that after they install this about 5 to 6 years out, they'll, put on what's called the Roof Max, which resprays the shingles and brings them back to life. So as they, kind of get older and they dry up or, it just brings them back to life.
Rejuvenate.
So, yep, rejuvenates them. So additionally with Heiser, as you guys can see, he is willing to do 2 years of payments of $25,000 a month with no interest. The other ones we would be paying out of pocket for the whole thing all at once and kind of save on budgetary and operational costs. It would be easier to do those monthly payments.
So this is something that your budget can handle, correct?
Yes. Mm-hmm.
Do we need to make a motion so we can have discussion on?
Motion to move this on to County Board. With the recommendation of
Kaiser Exteriors.
Yeah.
I'll second it.
Okay.
Madam Chair,
Yes,
who is first?
can't be me.
Then I'll.
You be first?
Yeah.
I'll second it.
So I have a question, Chairman. The documentation that's provided, I don't see the explanation of
Yep, if you
why
go-
we would be taking the higher bid, the highest bid out of.
like I said, just a few seconds ago, is we get the monthly payments at no interest. So we can't,
Excuse me, I heard you say that, but I don't see where it's documented in the recommendation. Maybe I missed it.
it says, one more.
It talks about the payment piece, but the other components to it about resurfacing the.
That's under the warranty. So if you keep going, right in there, warranty. So it goes over all the project details, it goes over the warranty, so it's a 10-year warranty. And then a 10-year workmanship warranty on top of it, so anything that does go wrong and can go wrong will be fixed by them, natural disasters. Is the only thing that's not, I mean, obviously covered, that would be covered by insurance. But if it's something like installation or things going.
Yeah, so Chairman, my concern is to specifically address why we're selecting the higher bid and calling out these pieces. Because it explains what, their warranty covers, but I don't see the comparison between the bids to explain why one of the higher ones is our choice. Specifically addressing that we're.
I think we went this way because when we discussed it during Building Facilities Committee, we knew Pine Valley needed a new roof. And we went with this because this way Pine Valley can pay for it out of their own budget and not the county's budget. We don't have to worry about county levy going up for that. And, you know, they're willing to agree to $25,000 a month, no interest. That's a biggie right there. Where with the other two here, from what I've been reading, they want that money up front right now.
Yeah, one of them only allows for a $25,000 finance option, so they would only allow us to finance $25,000.
Right. And
Whereas
then there's
this one
interest
allows-
on that.
Correct. So
So,
this one is more of a financial piece, not what one can do better than the other. It's more of a financial and just kind of that warranty piece.
the one thing you may, if I may, the one thing you may want to ask them, Brittany, if they can put in that spray thing somewhere in their warranty, so that is spelled out.
He's willing to come to the county board
Is
and
he?
just kind of go over. Yep. So I've already talked to him and he is willing to come to the county board. So if you guys have questions, just kind of on the structural piece, he's willing to be there.
My suggestion is under the recommendation where it says it provides the best value, I would list some of the items that we're seeing as higher value, just so it's explained clear to others without having to read and compare each of the vendor proposals side by side.
Sure, you can do that.
Any other comments?
This is the only one that fits your budget in terms of being able to pay it back within a reasonable time frame.
I'm sorry, repeat that. It fits our budget.
$25,000 a month is okay with your budget?
Yes.
So there wouldn't be any stretches or?
No, I mean, we have a pretty significant overcast after paying bills. Like our net normal bills. So there's usually a pretty good, I mean, we're sitting at, I think last year, $2 million overhead, so I mean, each month kind of projects that, about a couple $100,000 extra in our bank account every month.
Just given the tight budget on county board, I think Sandra's comments makes sense.
Yeah, the idea was not to put any strain or put any of that financial piece onto the county board. And that we wouldn't be able to self-sufficiently pay for this, where it would not jump into your guys' budget at all, or have to affect it in any manner.
But how many more years is the county gonna be paying you for Pine Valley before we're done? Is it like 8 years?
Yeah.
Think what we're gonna have when we get all done paying that. And they got the new roof and the new interior. Shit, we're really doing it.
Oh, shit.
Okay. Any other questions or comments? Mr. Perry?
Well, I was just thinking if Mr. Carroll were here,
I know.
he'd be asking you for individual itemized.
I have another comment. In the agenda item cover, under the financial review, there's verbiage there, but none of the boxes are checked. It says, please check one about the impact to budgets.
So I think that, is that for specifically, because I don't think it'd impact you for budget. Probably be easier. And we've had funds set aside specifically for this for a couple of years now, so it wouldn't impose, we do have funds set aside for the roof.
But what that bottom box does, and we can start making sure we do that, is tells us which funding source we're gonna use to pay for it.
Perfect, we can do that.
Okay. With those changes, Brittany, make sure you get this done before county board 19th. All in favor of moving this on to county board?
Aye.
Say nay. Thank you. Mr. Carroll will have his chance.
He'll do that with
It's
Sean, because I'm
organized.
not.
Did we have any correspondence? Anything for future agenda items? Item number 14. What's that?
I have a couple. We need to do our 2025 annual report next month. And for the new people, I think that'll be a great opportunity for Health and Human Services to really kind of go through each program and share that information with you. So, and then also too, as we're coming into budget season, we're required to do a public hearing on the budget. I think historically we've done it in July, but by July we've already kind of started to submit our proposals to administration. So I'd like to move that up to June and make it a public hearing. Historically we've done it in the evenings. However, we never get anybody coming in the evenings. So we're okay if we just leave it at our normal time and make it a part of that. If that's okay with everybody.
What time is that then? The annual meeting?
It'd be
Public hearing, I'm sorry.
It'll be 10:30, part of our normal meeting. What it'll do is it'll be the public hearing and then then we'll switch to the regular. I think that's how it works.
Because usually with public hearings, we do it for ADRC, our transportation, I should say. And we advertise it, tell it on the radio, nobody comes. I don't know why, because it's their money that we're going to be spending. Sometimes you might get one or two. A lot of times we don't get in, and if there's no one there for the public hearing, we close that part of the meeting, go right on to the next one. So sometimes that part is less than 3 minutes. So
I have a question, and it might be for an agenda item. So we went through some of the financial reports for some of the other areas. Is the Pine Valley financials, is that presented at some point too? Or is that not
Executive
appropriate for this meeting?
No, it should, and we can start getting it presented here. It was something that was presented at the Pine Valley Committee, so we can just start having it presented here.
Yeah, I think we presented the vouchers. Yeah, the financial person there would sign off on the vouchers.
Got everything? Anyone else want to add something? I need a motion to adjourn.
I make that motion.
And
Second.
I'll second.
Okay. All in favor, please say aye.
Aye.
All
Aye.
opposed? You may stay.
Very good.